You've heard of Ozempic face. Maybe you've seen it on a friend. Maybe you're seeing it on yourself. Today, we're going to explain exactly what it is, what causes it, which GLP-1 drugs are involved, and why the newest, most powerful weight loss drug on the horizon may actually make things worse before the medical community fully catches up. The term Ozempic face was coined in 2023 by New York dermatologist Dr. Paul Jared Frank. He noticed a dramatic pattern among his GLP-1 patients. They were losing weight successfully, feeling better than they had in years, but their faces were telling a completely different story. Sunken cheeks, hollowed temples, deeper lines around the mouth and nose, loose skin along the jawline, an overall appearance of premature aging, sometimes making a patient in their 40s look like they're in their late 50s. It's not officially a medical diagnosis. You won't find it in any diagnostic manual, but it's a very real, increasingly common clinical observation, and it's not limited to Ozempic. More on that in a moment. Your face has a sophisticated architecture of fat compartments. The malar fat pad in your cheeks, fat around your eyes, volume in your temples. These structures are what give a youthful face its fullness, its lift, its structural support. When you lose weight rapidly, as GLP-1 medications are designed to help you do, your body depletes fat globally, and the face, with its relatively small fat stores, can show these changes dramatically. A 2025 study from Vanderbilt University quantified this. Approximately 9% of mid-face volume is lost for every 10 kilograms of total body weight lost. For someone losing 20 or 30 kilograms, common on higher-dose GLP-1 regimens, that can be a profound and visible change. Here's why it looks like aging rather than just looking thinner. As we get older, we naturally lose facial fat gradually, and our skin adapts. But when weight loss is rapid, over weeks and months rather than years, the skin's remodeling capacity is simply outpaced. The scaffolding disappears before the skin has time to tighten and adjust. The result is sagging, not slimming. But fat loss isn't the whole story. Recent research suggests GLP-1 receptor agonists may have a more direct effect on skin health. A 2025 peer-reviewed review found evidence that GLP-1 drugs may suppress the activity of dermal white adipose tissue and adipose-derived stem cells, the cells that help maintain collagen and skin structure. In other words, the drug may affect the skin's architecture beyond just taking away its fatty support. Then there's muscle. The Step 1 trial, the landmark semaglutide study, found that without adequate protein intake and resistance training, up to 40% of weight lost on the drug can come from lean mass, not fat. Facial muscles, though small, are part of this equation. When they atrophy, the soft tissues have even less support and descent accelerates. It's a triple hit. Fat loss, collagen disruption, and muscle atrophy, all happening faster than the face can compensate. No. Despite the name, Ozempic face is not exclusive to semaglutide. It's a consequence of rapid weight loss, whatever the cause. And that means it occurs with every GLP-1 medication. Tirzepatide, sold as Mounjaro for diabetes and Zepbound for weight loss, is a dual GIP and GLP-1 agonist that produces even greater weight loss than semaglutide. In the SURMOUNT trials, patients lost 20 to 22% of body weight on average. Greater weight loss means greater facial volume loss, so tirzepatide may actually carry a higher risk of these changes. And then there is retatrutide, a triple agonist from Eli Lilly targeting GLP-1, GIP, and glucagon receptors simultaneously. Phase 3 trial data released just in December 2025 showed average weight loss of 28.7% of body weight, nearly 71 pounds, over 68 weeks. These are the largest weight loss numbers ever recorded in an obesity drug trial. The glucagon component is often cited as a potential muscle-sparing benefit. But here's the reality check. Even if the ratio of fat to lean mass loss is somewhat better, losing over a quarter of your total body weight means losing enormous amounts of subcutaneous facial fat in absolute terms. No published facial outcome data exists yet for retatrutide, but based on the scale of weight loss, clinicians should expect these changes to be at least as prevalent, if not more so. If you're currently on a GLP-1 medication or thinking about starting one, here is what the evidence tells us works for prevention. First, slow down the weight loss. Target no more than 1 to 2 pounds per week. This gives your skin time to adapt. Using a lower dose or asking your provider about titration strategy can help achieve this pace. Second, protein. Clinical guidelines recommend 1.2 to 1.6 grams of protein per kilogram of body weight daily during GLP-1 therapy. For a 180-pound person, that's roughly 98 to 131 grams per day. Protein preserves lean mass and supports collagen synthesis. Third, resistance training. Strength exercise signals your body to preserve lean mass. Combine it with adequate protein and you meaningfully shift the composition of your weight loss. This targets body fat rather than facial tissue. And fourth, start thinking about your skin. Topical retinoids stimulate collagen production and can help your skin maintain elasticity during the loss phase. Hydration, sun protection, and quality skincare routines all contribute. Think of skin health as a proactive investment, not an afterthought. So, Ozempic face is real, and it happens across all GLP-1 medications. In our next video, we cover every treatment option available right now, from injectable fillers to surgical facelifts. Subscribe so you don't miss it. For more stories and clinical insights, visit unbedsidemanners.com. We'll see you in the next one.